So welcome if it's your first time here. Welcome back if you've been to our webinars before or are on our coaching platform. Lovely to see you guys. Well, we've got a whole lot to cover. It is going to be a jam-packed 60 minutes. So we're going to hop right in it. And then those that are still sliding in, no problem, you can join in. All right, let's get going. So women's health. Mention the unmentionables. We're going to talk about all kinds of things today. So my name is Ashley Honeycutt, if we haven't met yet. I am the Director of Health Coaching Operations here at YourCoach Health, as well as a board-certified health and wellness coach myself. And we do these continuing ed webinars. Super exciting. We learn lots of cool things, talk about all kinds of ways that we can help create happier and healthier humans as health and wellness coaches. And of course, for those of you that haven't met YourCoach yet, it is my pleasure to introduce you to YourCoach. We are the all-in-one platform. We're tailor-made for health and wellness coaches by a health and wellness coach. Our platform is designed to give you everything that you need to run your practice smoothly. That's things from chat to video sessions to session notes, and a comprehensive library of resources. It's all the tools you need to manage your health and wellness coaching practice. And at YourCoach, we're committed to supporting you in every way possible. So that's why we offer things like these webinars, access to legal experts, business coaches, other valuable resources to help you grow and sustain your coaching practice. And all of these additional things come at no additional cost to our community members. So that even includes the CEU credits for webinars like this one. And what makes YourCoach truly unique is that it is the only operating system for behavior change that's powered by health and wellness coaches like you. And we're partnering with organizations across all various industries to demonstrate the value that health coaching can bring to their clients, members, and talent. By connecting individuals and coaches with you guys, with your coaches who use the See, I can hear my puppy dogs. I hope you guys don't hear them. By connecting individuals with certified coaches who use the YourCoach platform, we're providing personalized support to help them achieve their goals. And through all of those partnerships, we are building a global health coaching ecosystem that empowers coaches to reach even more people. Our mission is to introduce health coaching to as many organizations, individuals, and communities as possible using the evidence-based methodologies to bring about real health change. At YourCoach, our mission is to create a world where every individual has access to a health coach by 2030. In short, it's to help create more happy and healthy humans, which is what we're all here to do, is learn how to create more happy and healthy humans. With that, let's dive right into today's topic. Women's health, mention the unmentionables. We always start these webinars with a reflection. I think they're super impactful, and it's a great moment to just pause and explore our own beliefs, our comfort zones, our biases, and our experiences around the topic we're going to be covering. So with that, I'd love if you would just take a moment. I'm inviting you to think about women's health and what words come to your mind when you think of that. What feelings do you notice arise within you when you think about coaching clients around women's health? And when you think about your confidence in working with those clients on women's health issues, how would you rate your confidence on that scale of 1 to 10, right? With 1 being not confident at all and it makes you want to run away, to 10, like, let's start right now, I'm ready to go. Take a brief moment to just consider those things, center yourself, contemplate the questions, and prepare to dedicate the next rest of our hour to enhancing your coaching toolbox. If you feel comfortable, you can even drop a few thoughts into the chat. But let's just take about 10 or 15 seconds just to center ourselves and think about that. Women's health is a really complex topic. And it's a complex topic for health and wellness coaches, particularly for several reasons. So first, women's health needs are absolutely unique, and they can vary throughout all the different stages of life, all the way from puberty to pregnancy, postpartum, menopause, and beyond. And as coaches, we need to have a deep understanding of the physical, mental, and emotional changes that women undergo during these stages, as well as the impact that they have on women's health as a whole. Secondly, women may face specific health challenges that are unique to our gender. So things like polycystic ovarian syndrome, PCOS, endometriosis, and menstrual irregularities, among a lot of other challenges. And these conditions come with their own unique physical and mental challenges that come alongside them. Third, societal and cultural factors. they can also affect women's health. So these could be things related to gender, such as discrimination, violence, gender-based roles and expectations. They all impact women's health and well-being. And we need to be sensitive to these factors and be equipped to provide support that's specific to women's experiences. And also, last but not least in there is that women's health research has historically been underfunded and understudied until recent decades. And that results in a somewhat more limited information on women's health issues. That comparative lack of data can make it challenging for health and wellness coaches to find resources for evidence-based programs and interventions that are specific to women's needs. Although we are definitely seeing a shift towards women-specific care, and there are a lot more resources available today than even 10 years ago. But with all of that, it would be impossible for us in this hour to cover the many nuances of women's health. And so we're going to touch on some of those common challenges that arise around women's health and look at case studies for how health coaches can help women with those challenges. So we always want to equip you with the tools and the knowledge, but also applicable ways that you can work with clients that have these challenges. So we've got lots of case studies to go through today. And the good news is around all of this, even with these challenges, there is a lot that we can do within our scope as a health and wellness coach that has the power for real behavior change and to really impact women's health. So for today, we're going to use the hormonal stages to guide us through the tools and the skills that we can leverage. But I really want to pause here and just point out that we are most definitely not saying that all women's health concerns are related to hormones, nor are women simply subject to their hormonal cycles. As we've already said, women's health is incredibly complex, and we're simply going to use the hormone cycle as a way to organize those health concerns and move through a lot of them. The hormone stages can definitely bring their own health concerns at each stage, but they are not the only health concerns for women. So we're going to talk about a lot of things. Some might even say the unmentionables, which I'm really excited to dive into. So we're going to talk about things like menstruation, sexual health, breast health, and so much more, because we're here to make happier and healthier humans. And that means normalizing and attending to women's health, all components of women's health. So before we dive into those specific hormone cycles, there's some core ways that a health coach can help regardless of where in the hormonal cycle of womanhood a client may be. So we can help with things like education, having vetted resources available to share with your clients. Discuss resources they may have received from their clinician and their understanding of these resources. So it's pretty typical for a client, they go in, they speak with the doctor gives them a nice pamphlet or refers them to a website, they read it, but they're not really sure what it means. So having that opportunity to discuss what they understand and what knowledge may be missing or what gaps may be there can be really empowering for the client to make sure that they feel in control of their health journey. It's just really overwhelming for them. And if you want to provide your own resources on top of any that they may have already received from their clinician or from another source, just make sure that they're vetted and they're from reliable sources. So things like CDC, Mayo Clinic, the WHO, World Health Organization, they're all great options. And then when you do want to apply those resources or ask if your client is interested in those, there's a couple of best tips. One is ask for permission. While it may appear as an apparent thing, it's essential to ask or wait for your client's approval before providing educational resources. And this approach really allows you to understand precisely what kind of information your client needs. And that's going to strengthen your relationship by giving them the freedom to choose and putting them in charge of their journey. Another one is to just provide that just-in-time information. So this is where we address the client's unique requirements by providing only the information they request when they need it. So we're not front loading them with a ton of information. We're figuring out through that rapport and the conversation that we're having what they need in that moment. So although we can be super enthusiastic about showcasing our knowledge and sharing all these tips for new nutrition and exercise information, it probably won't be most effective unless it relates to the client's personal experiences when they're ready to receive it. And then also we can offer that information in a format that the way the client prefers it. There's a lot of different modalities and ways we can relay information. So they may prefer a book, they may prefer a blog or a podcast, and some may want a single piece of paper with some bullet points on it. Knowing your client and how they like to receive information can also help us determine how best to get that to them. And of course, resources can be phenomenal, but they do not replace coaching. So always remember that your clients are seeking your guidance and support, and they use that to make those long-term lifestyle changes. So simply providing information isn't enough. That's not where real behavior change happens, right? If it was, then libraries would be the biggest catalyst for behavior change, and doctors would be able to give those brochures and everyone would be happy and healthy. But the real value as a coach lies in assisting clients and taking that knowledge and applying it to their individual lives. So a client can know that exercising 30 minutes a day is beneficial, but if they can't see how to take that knowledge and implement it into their routine, they're not going to reap the benefits of it. So this is where real behavior change happens, and health coaches can really make a difference. We're empowering the clients, right? And then, of course, lifestyle changes. What lifestyle changes have been recommended? What can help improve their condition? What have they tried before, or maybe are interested in trying now? And then we can take all that and help the clients create a plan. Put those changes into a plan specific to the client. We always say over and over again, if you could take this exact plan and this exact goal and apply it to any client within your repertoire, it's probably not the right goal for that client. It needs to be specific to them. That's where the power of health coaching lies. So help them find a workable solution to include those changes in their lives. So you'll need to have really good rapport with your clients, and you need to really listen both to what is said and what is unsaid in the conversations. And accountability. As health coaches, we can fulfill many roles to support our clients. That's including active listening, providing educational resources and topics around all things health and wellness, coordinating behavior change programs, and offering motivation and encouragement. However, we can also serve as a bit of a truth teller, reflecting back to them their own statements and serving as a sort of mirror with which we can hold our clients accountable to their goals. So we can model and foster that accountability within our coaching relationships and provide that crucial benefit to our clients. Research consistently shows that accountability is a key factor in achieving success for any health and wellness goal. And as coaches, we can track our clients' progress along with them. So pro tip, we do have a goals feature in the platform that is perfect for this. You can input it and clients can track their progress on the goal. You can see it, they can see it. It's really neat. And they can also put in their own goals. It's all about empowering the client. And we offer all those tools to clients to be accountable to themselves, which ultimately leads them to their success. As coaches, we can also offer emotional support. We can be there, we can listen. Sometimes we don't have to do anything, we just need to be. And so remember, we can provide support by helping clients process their emotions, helping them move forward. But I would caution, just a word here, caution for scope. There can be a blurry line between supporting a client and treading out of scope and working with them to process emotions and past trauma. So we've talked a lot about how to navigate this in the Coaching in the Presence of Trauma webinar. And if you missed that one from the fall, you can find it on our YouTube. We do a whole lot on how to navigate that space there between clients that may be experiencing trauma and staying within our scope and still supporting them. And of course, motivation is a huge part of this, right? By tapping into the client's values and wellness vision, we can increase their motivation to change and keep that motivation throughout the stages of change for perseverance when motivation wanes, because it's going to, right? Motivation, it ebbs and flows, and we want to be there to hold them to their goals and help them reach their goals, even when motivation is low, help them recover that motivation and their ultimate why. And of course, we can have vetted referrals for clients who may benefit from another member on the care team. A lot of times it's not an either or, it's an and. We can include other clinicians or support services in the care team for this client and have them be a part of the team. So we can take all of that. It applies to every stage. And let's start breaking it down into the specific different stages of the hormone cycle. So for today, we're going to start with just menstruation. You'll notice we bypass puberty, and this is completely intentional as it falls more into the realm of children's health than women's health. And that's a topic for another time. Let's dive into the menstruation part of the hormone cycle. So this is going to be all the years between the conclusion of puberty and prior to the beginning of perimenopause. And we're going to take a look at some of the physical, emotional, and societal factors that can impact women's menstrual health. So first, the average menstrual cycle is 28 days, but normal can range anywhere from 21 to 35 days. And the average length of the menstrual period is 3 to 7 days, but can range from 2 to 8 days. On average, a woman will have 450 periods in her lifetime. Irregular periods can also be a common issue for many women, which can sometimes make it difficult to plan around their cycle. And we need to be aware aware of this and understand how it can impact a woman's life and well-being. There's also PMS, premenstrual syndrome, and it has a wide variety of signs and symptoms, including mood swings, tender breasts, food cravings, fatigue, irritability, and depression. It's estimated that as many as 3 of every 4 menstruating women have experienced some form of PMS. Symptoms tend to recur in a predictable pattern, but the physical and emotional changes that we experience with PMS can vary from slightly noticeable all the way to very intense and disrupting the flow of normal life. Women can also experience mood swings, anxiety, irritability, and other symptoms in the days leading up to their periods, and sometimes even during and even a day or two afterward. So even though it's called this premenstrual syndrome, it can actually last during and just a little bit after. And then there can also be some pain and discomfort, which is really common. Things such as cramps, bloating, headaches, etc. And this can be an ongoing challenge for some women. So menstrual cramps affect up to 90% of women at some point during their menstrual cycle. That's a huge percentage. So it's something we definitely want to be aware of. There could also be times of heavy bleeding. This can be a cause for concern sometimes, and sometimes it can be a normal part of the process. And we really want to help our clients feel empowered to know what is normal for them. So approximately 1 in 10 women experience heavy menstrual bleeding, which can interfere with their daily activities and sometimes requires medical intervention. As coaches, we want to be able to recognize the signs of abnormal bleeding, potentially have resources for our clients and help them feel empowered to talk to their clinician about it, and maybe even refer them out to medical attention if necessary. So for context here, the average amount of blood lost during a period is 30 to 40 milliliters, which is approximately 2 to 3 tablespoons. Additionally, some cultures and societies still view menstruation as a taboo topic. It can lead to feelings of shame or embarrassment for women, and we need to be aware of this and provide a safe and supportive environment for our clients to discuss these issues openly. In many parts of the world, menstruation is stigmatized, and it can lead to social exclusion, limited access to education and employment, and poor health outcomes. And lastly, access to menstrual products is also a significant issue for many women, as not all have access to the menstrual products they need to manage their periods. So things like pads, tampons, or menstrual cups. And this can have a significant impact on their quality of life during their cycle, and thus on their health and well-being. Lots of ramifications for all of these different issues coming together. So what are some common health concerns for women that are in these menstrual years? So we're going to focus on some of the most common ones. Let's talk about PCOS, this polycystic ovarian syndrome. Did you know about 10% of women have PCOS? It can lead to a whole range of issues, including irregular periods, weight gain, and fertility problems. It can be frustrating and challenging, and irregular periods can impact fertility and make it difficult to predict ovulation. And weight gain or difficulty losing weight can impact overall health and self-esteem. Another common issue is fibroids. These non-cancerous growths in the uterus can cause heavy bleeding, pelvic pain, and even infertility. The symptoms can be really tough to deal with, including frequent urination, constipation, and even painful sexual activity. And for women who are trying to conceive, fibroids can interfere with the implantation of fertilized eggs or block the fallopian tubes. And they may also want to come to us talking about endometriosis. It's a chronic and often painful condition where the tissues that line the uterus actually grow outside of it. So this can cause symptoms such as pelvic pain, painful periods, heavy menstrual bleeding, and painful sex. It affects an estimated 1 in 10 women of reproductive age worldwide. And while there is no cure for endometriosis, there are treatments available that can help manage symptoms and improve quality of life. So medical intervention may be part of their care plan. And there are also a lot of lifestyle factors that can help, particularly with PCOS and endometriosis. So having those vetted resources and empowering our clients to know what they may want to try to help relieve these symptoms can be really impactful. And of course, fertility and reproductive health are common concerns. So 1 in 8 couples struggles with fertility issues. And as a health coach, we can provide support and education around fertility to help women optimize their chance of conception or prevent conception, depending on their goals. And this can include guidance on stress management, emotional regulation through the ups and downs, healthy lifestyle habits, and understanding menstrual cycles in their body. And finally, pregnancy and postpartum health can be challenging for many women. So from difficulty getting pregnant to high-risk pregnancies, there's a whole range of issues that can arise. And postpartum depression affects up to 1 in 7 women after giving birth, and it can be emotionally and physically challenging. Within that, you can also have breastfeeding challenges that affect both the mother and baby. And all of these also have an emotional and mental component to them as well. It's not just the physical challenge. Now, if you're working with a client in the fertility cycle, particularly, this would be that pregnancy and postpartum care, there's some additional things to know here. This stage can have its own nuances and client challenges. And while we want to be mindful of our scope, regardless of what client we're working with, this is an area to be even more mindful, because it's not just our client, it's our client and potentially baby that we are working with. So clients who come to us in this phase may want to work on a couple of different things. One could be just difficulty getting pregnant, right? Infertility, it affects about 1 in 8 couples. And women can have difficulty getting pregnant due to a variety of factors, from irregular menstrual cycles, hormonal imbalances, blocked fallopian tubes, or age-related decline in fertility. Could also be their partner, right? It's not necessarily the woman's infertility. It could be an issue with her male partner. We're just not sure. Again, as a health coach, we would not diagnose. We wouldn't dive into that. That would be left to a medical professional, but we can help the clients work through stress management, working through putting in any lifestyle changes that the doctor has recommended. We can work with medication reminders if they're taking medication for this, how to set them up for success for all of those pieces they need to improve their odds for fertility. And if we're successful, maybe we have a high-risk pregnancy. Women who have pre-existing medical conditions such as diabetes, high blood pressure, or thyroid disorders may have a higher risk of complications during pregnancy. In cases where pregnancy complications arise, things like gestational diabetes, hypertension, preterm labor, a health coach can work with women to manage these conditions and prevent further complications by implementing lifestyle changes or physician-directed changes to their routine. So this could be things like education, resources to help women understand their condition and make informed decisions about their health. And in addition, women who are pregnant with multiples or have had multiple pregnancy complications can also be considered high risk. And it can be a really exceptionally stressful and high anxiety time. So working on those mindfulness techniques and on stress reduction techniques can be huge. Unfortunately, miscarriage is something we might encounter with a client. Miscarriage is the loss of a pregnancy before the 20th week. About 10 to 20% of known pregnancies end in miscarriage, and it can be emotionally and physically devastating. There could also be preterm labor or stillbirth. Losing a child is hands down one of the most devastating experiences anyone can go through, and it can be especially difficult for a parent to navigate the grief and emotions that come with such a loss. And as a health and wellness coach, we can provide valuable support to a grieving parent by offering them compassionate listening, holding space for them, offering support, and helping them find ways to cope with their loss. Again, we absolutely want to be mindful of our scope here. And our favorite saying, when in doubt, refer out. If our clients would benefit from support beyond our scope, don't be afraid to refer them out to a resource who can really help them through this time. Also, postpartum depression. Postpartum depression affects up to 1 in 7 women after giving birth, and it can cause symptoms such as extreme sadness, anxiety, fatigue, and difficulty bonding with the baby. We can, again, hold that space for them. We can talk to them. We can help plan to adjust to this new stage of life. But when in doubt, refer out. And also postpartum physical recovery. After giving birth, women can experience physical symptoms such as pain, bleeding, extreme fatigue, and it can take several weeks or even months to fully recover. Mothers perhaps who had a birth plan that didn't go according to plan, they can experience disappointment around that. And in some cultures or circles, maybe they're experiencing a little bit of shame over any complications in the birthing process. A common one is a little bit of shame around a cesarean section. And although we may think there's no shame in that, if we have a client who is feeling that, we want to hold space for that, right? And as coaches, we can provide that ongoing support after delivery, helping women navigate all of the physical and emotional challenges that occur postpartum. Lots of self-care opportunities in here, a lot of emotional support opportunities. These women are adjusting to a completely new routine and a completely new lifestyle, and they may not be sure what that's going to look like for them. They're not sure how to still be themselves and still blossom into their new role as a mom. So here is a great opportunity to even just acknowledge that and say something like, your body's going through a natural process. It's okay to take care of yourself during this time. What do you need in this moment? Can really give that client permission to focus on themselves and not just on the baby. And that can be really comforting, because in that time after you have a baby, everybody comes to your house or the hospital or wherever, and they want to see the baby. They ask how the baby is. And sometimes mom can feel forgotten. So just holding that space for mom can be really, really impactful and empowering for mom. We could also have some breastfeeding challenges. Some women may have difficulty breastfeeding, and that can be due to a lot of different factors, things like nipple pain, inadequate milk supply, the baby's inability to simply latch. And these can bring strong emotions. Again, we can have emotions of failure, shame, or frustration around that. We could see changes in our breast size and shape due to pregnancy and breastfeeding, or even other factors, and that can affect body image and self-esteem. Just being present and holding that space can feel really supportive. We could even say something like, it's okay to feel frustrated and overwhelmed. You're doing something you have never done before. New things can be hard, and it isn't fair to expect yourself to be an expert at something new. Every mom and baby is different. Let's work together to find solutions that work for you and your little one. What have you tried so far, and what ideas do you have to try next? I can also supply some resources if that would be helpful. Health coaches are primed to support women throughout all these different stages of conception, pregnancy, and postpartum care. And it's a huge time of change in a woman's life, both physically and emotionally, and learning how to maintain that healthy routine throughout it can really be a challenge. It's a place where health coaches can really shine to set mom and baby up for a lifetime of health. Let's look at some case studies. Let's see how we can take this information and put it into practice as a health and wellness coach. So first, we're going to take a peek at Sarah. Sarah is a 30-year-old woman who is trying to conceive with her partner. She's been trying for 6 months, but has not been successful. She's feeling anxious and stressed about the situation and is concerned that there may be an underlying health issue. Sarah has a history of irregular periods and is unsure if this is impacting her ability to conceive. Now, as her health and wellness coach, we could absolutely empathize that trying to conceive can be a challenging and very emotional time. We could work with Sarah to develop a tailored plan to optimize her fertility, such as finding practical strategies to improve her nutrition, her physical activity, stress management, all of which can have a significant impact on her ability to conceive. And we could also brainstorm different ways she can track her menstrual cycle and identify her most fertile days, helping her gain a better understanding of her body, and also allowing her to make more informed decisions when it comes to her fertility. Also, given Sarah's history of irregular periods, I would also encourage her to seek medical attention and explore any recommended complementary services that may support her fertility. Again, we're not prescribing anything to her. We're not telling her that's what she needs to do. We're equipping her with lots of resources so she can make the choice that feels best to her. We can also review that information and resources together to help her make the most informed decisions. And maybe most importantly, the piece here, we could offer emotional support and encouragement to Sarah. Trying to conceive can be really stressful, really overwhelming, and it's essential to have someone to talk to during this time. And we could work with Sarah to develop a plan to monitor her progress, explore additional medical interventions if needed. And really my goal, if I was her coach, Sarah's coach, would be to help her feel empowered, supported, and confident throughout her fertility journey. So I might say something to her like, starting your family is important to you, and it's totally normal that you're feeling really anxious and stressed about conceiving. It's okay to feel overwhelmed, but you don't have to go through this alone. I'm here to offer resources and support, and we'll work together to navigate this journey towards starting a family. It's important to remember that it can take some couples longer than others to conceive. However, given that you've been trying for 6 months and are feeling anxious along with your irregular periods, I wonder what your thoughts might be about speaking with your physician or a fertility specialist and adding them as another member of our care team. In the meantime, there are some lifestyle changes that we can make to help improve your fertility odds. Focusing on healthy eating, staying active, and finding ways to manage your stress can all contribute positively to your overall health and well-being, as well as optimize your fertility. We leave the power in the client's hands, but also share knowledge and resources that could potentially benefit their journey. The most important thing is the client be empowered on their next steps. And we can also look at Emily. Emily is a 29-year-old woman who has been diagnosed with PCOS, that polycystic ovarian syndrome. She's been struggling with irregular periods, weight gain, acne, and excess hair growth. Emily is also experiencing anxiety and depression related to her condition, as she feels like she has no control over her body. She's tried various medications and treatments, but has not seen significant improvement. So as her health and wellness coach, we could work with Emily to help her develop a personalized plan to manage her symptoms, including strategies, again, to improve her nutrition, physical activity, and stress management. We could offer brainstorming and support on tracking her menstrual cycle and identifying patterns in her symptoms. We could provide resources and education on the connection between PCOS and insulin resistance and strategies to manage blood sugar levels. CDC has some great ones for that. We could work with Emily to develop a plan to monitor her progress and explore additional medical interventions if needed, even saying something like, you've been through a lot with your PCOS diagnosis. It can be really frustrating and you're not alone in that. I know that you've tried various treatments and medications, but you haven't seen significant improvement. Can you tell me more about what you've tried and how it made you feel? This can help us understand what has worked and what hasn't, and what next steps might feel best for you. And once she responds, we could dive into that even further and say something like, there are many options available to manage your symptoms, and you're actively working with your doctor to try some new medications. In addition to medical interventions, there are lifestyle changes that can be effective to support women with PCOS, such as regular exercise, reducing stress levels, and following a healthy, balanced diet. Are there any changes you'd like to make in your lifestyle that might help you feel better and support the work you're doing with your doctor? With this, she may or may not have received lifestyle recommendations from her doctor, but we can always share those vetted resources. Again, CDC, Mayo Clinic, WHO, lots of women's health organizations, Harvard Health has a great one, and we can have those available. And if she's amenable to looking at those resources, we could share them. Rapport is important here. We can't have these conversations without rapport. So I just want to pause and point back to that. And if you want more information on building rapport, again, we did a webinar on that back in January, and you can watch that on the YouTube channel as well. Lots of great tips for building rapport. These conversations can be really difficult to have without that present first. All right, then somewhere around 40 to 50 years old, we're going to move towards perimenopause, although symptoms can start as young as 35. So perimenopause is the transitional phase before menopause, when the body's hormone production begins to decline, courtesy of the declining ovarian function. Perimenopause varies greatly from one woman to the next, and the average duration is about 3 to 4 years, although it can last just a few months or extend as long as a decade. Perimenopause can sometimes become the tip of the iceberg. It becomes really easy to blame for any symptoms that are going on in the woman's life, and all future menopausal symptoms kind of fall in there as well. So digging into what other things may be going on is helpful. It becomes really easy to just blame perimenopause, right? Like, I'm not feeling well, I'm tired, it must be perimenopause. I am out getting and I get really cold really easily, it must be perimenopause. So it's very common for this to happen. And so we want to help our clients really settle in and be able to know their bodies and assess what they're feeling. And during this perimenopausal time, women can experience a whole range of physical and emotional symptoms. So some of the common ones are irregular periods. So this is usually one of the first symptoms, and this can include heavier or lighter bleeding, some missed periods, and longer or shorter cycles. Can also include hot flashes and night sweats. Fluctuations in hormone levels can cause hot flashes, night sweats, can be really uncomfortable and really disruptive to sleep. An estimated 35 to 50% of perimenopausal women suffer sudden waves of body heat with sweating and flushing that last at least 5 to 10 minutes, often at night, but sometimes during the day as well. And they typically begin in the scalp, face, and neck, and then move into the chest, and they can differ dramatically among women who have them. Some women feel only slightly warm, while others end up wringing wet. And the whole spectrum is completely normal. Hot flashes often continue for a year or two after menopause. So in up to 10% of women, they persist for years even past that. Hot flashes tend to come on rapidly, and they range in severity, again, from that fleeting sense of warmth to being completely consumed by fire from the inside out, is how some women have described it. A major hot flash can induce facial and upper body flushing, sweating, chills, and sometimes even confusion. Having one of these at an inconvenient time, so such as during a presentation, a job interview, or even an interlude, can be quite disconcerting and can really affect a woman's self-confidence and her trust in her body. Hot flash frequency varies wildly though. Some women have them, some women are very mild. Some have them over a course of a week, others experience 10 or more in a day, plus more at night. All of these can be normal for perimenopause and menopause. There can also be mood changes. So perimenopause can cause mood changes, including irritability, anxiety, depression, and estimates put the number of women who experience mood symptoms during perimenopause somewhere around 10 to 20%. The best predictors of mood symptoms at midlife are things like life stress, poor overall health, and a history of depression that can increase those risks of mood changes. We can also have sleep disturbances. So changes in hormone levels can also disrupt sleep, leading to insomnia and other sleep disturbances. Energy lowers, that fatigue sets in. You may feel like you need a nap, feel like you don't want to go to bed at your regular time. You're bumping it up, maybe going to bed right after dinner instead of your usual bedtime routine. About 40% of perimenopausal women have sleep problems, and some studies have shown a relationship between night sweats and disrupted sleep, but others have not. So the problem is too complex to blame on hormone oscillations alone. Sleep cycles naturally change as we age, and insomnia is a common age-related complaint in both sexes, so men and women both. During perimenopause, we can also have a decreased libido. So changes in hormone levels can decrease sex drive. Hormonal changes can make sex uncomfortable or even painful. And during late perimenopause, falling estrogen levels can cause the vaginal tissue to become thinner and drier. It can also cause some itching and some irritation. Again, this has a physical component, but can also have a very mental component for women. It's important to know in perimenopause, every system can be affected. Memory, skin problems, GI, everything. But it is not the only cause for women's health issues. So while they can cause it, they are not the only cause. There can always be other conditions going on as well. So in addition to those symptoms, there are some common health concerns that kind of go along with perimenopause. So hormonal changes. So since perimenopause is a stage of transition that's leading up to menopause, estrogen and progesterone levels are going to fluctuate more than usual. And these hormonal changes can cause a range of physical and emotional symptoms. Lots of things we just talked about with the symptoms like irregular periods, hot flashes, night sweats, all of those things. But certain lifestyle factors such as smoking, a sedentary lifestyle, and a diet high in processed foods can exacerbate those perimenopausal symptoms. There also can be some bone health concerns. So women began to lose bone density at a faster rate than before during perimenopause, and it puts them at a higher risk for osteoporosis and fractures. It's important for women at this stage to get adequate calcium and vitamin D and to engage in possibly weight-bearing exercise to help maintain their bone health. We also have some heart health concerns at this stage. Estrogen has a protective effect on the heart, and as those estrogen levels start to decline, women may notice an increased risk for heart disease. So again, it's important to maintain those healthy lifestyle factors. Mental health can be another one. So there can be increased stress, anxiety, depression that start to appear during perimenopause, again, due to these hormonal changes and other life stressors. So women with a history of depression or anxiety may be at a greater risk for mood changes during perimenopause. Concerns about aging can also develop or become worse during this stage. And as a result of all those symptoms and changes, some women develop those feelings of depression and anxiety that are really severe and don't go away. So practicing self-care and stress management techniques can be really powerful, but also having another resource for that mental health care can be really powerful at this stage as well. And sexual health. Perimenopause can absolutely affect sexual health, including changes like we talked about with libido and vaginal dryness, which can impact a woman's sexual health and relationships. And we can work with clients to formulate a plan in confidence to discuss any concerns with their healthcare provider, as there are treatments available to address these issues, but a lot of times women don't feel comfortable talking to their provider about it. So we can help them come up with those questions, come up with ways to boost their confidence so that they feel empowered to go have those discussions. So perimenopause is a natural and normal part of aging for women, but it's also normal for women to struggle with the physical and emotional changes associated with stage. Let's look at some more case studies. So first, we're going to have Maria. Maria is a 48-year-old woman who has been experiencing irregular periods for the past few months. She's also having trouble sleeping and has noticed that she's gained weight around her midsection. Maria is feeling anxious and irritable and is having trouble concentrating at work. She's never had any major health concerns before and is feeling overwhelmed and unsure of what to do. Now, as Maria's health coach, we would want to listen and reflect her concerns with empathy. She's facing a lot of challenges all at once. We want to encourage her with hope, tangible steps and actions that she can take towards managing her symptoms and helping her feel less alone. These are all ways we can be really supportive to her. So we could say something to normalize her experience and reassure her that she is not alone. And that could sound something like, I want you to know that you're not alone. Many women go through similar experiences during perimenopause, and there are many strategies that can help manage these symptoms. As your health coach, I'm here to support you every step of the way, and we can work together to develop a personalized plan that addresses your specific concerns and helps you feel your best. How does that sound to you? Now, while each person has their own unique experiences throughout this stage, Maria has shared some common concerns, things like gaining weight around her midsection, trouble sleeping, irregular periods, anxiety, feeling irritable, trouble concentrating at work, feeling overwhelmed. We've got a lot of things here. And together we could break down each of these concerns and then help her make some lifestyle changes that could support health and hormonal changes. So even saying something like, our bodies do change as we age, and what worked for us in the past may not work as well for us now, but that doesn't mean we can't make positive changes to support our health. Would you like to work together to come up with some new ideas for healthy meals, exercise and sleep routines, or even some stress reduction habits that will work better for you now in this stage of your life? What feels like the best place to start? For these types of hormonal changes, the overwhelm and intensity can be life-changing. It's important to stay present and listen rather than go right into trying to fix it. Allowing that safe space for your clients to discuss these often uncomfortable and major life interruptions can be a powerful force. And then together you can brainstorm ideas or curate a schedule that incorporates these new techniques and actions to avoid or manage the triggers that are most disruptive to her life at that time. We can also look at Lena. Lena is a 52-year-old woman who has been experiencing hot flashes and night sweats for the past years. She's noticed that her sex drive has decreased, and she's concerned about her risk for bone loss and osteoporosis, as her mother has a history of osteoporosis. Lena's tried some natural remedies, but nothing seems to be helping, and she's feeling frustrated and discouraged. So we could respond with something like, you've been going through a lot with your symptoms, and we can chat through them one at a time. It's understandable to feel frustrated and discouraged when the natural remedies haven't provided relief. Hot flashes and night sweats can be caused by hormonal changes during menopause, and there are options available to help manage those symptoms. Would you be open to some resources that outline different options? Then we can work together to explore and find what works best. Additionally, I understand your concerns about bone loss and osteoporosis, and they are valid, especially given your family history. We can work on developing strategies to reduce your risk, such as increasing your calcium and vitamin D intake and engaging in weight-bearing exercises. Finally, I also want to acknowledge your concerns about your decreased sex drive. It's common for menopause to affect sexual desire, but it can be distressing nonetheless. Let's discuss how this is impacting your life and any concerns you have, and explore options to help you feel more comfortable and satisfied. Ultimately, I want you to know that I'm here to support you and help you navigate this new chapter in your life and feel your best. What feels like the best place to start? By addressing the concerns individually, we acknowledge them and we participate in active listening. And then by moving the focus in and narrowing it down to one place to start, we focus the client and bring those feelings of overwhelm down and help them be present in the moment with one actionable item. Remember, there are lots of right ways to approach this client. That is by no means the only way. Lots of correct ways you can do that. This thing is to stay within your scope, stay engaged, listen, and reflect back to the client so that they can stay empowered and in control of their health journey. Then we're going to move into the menopausal stage. This typically occurs between the ages of 45 and 55, although with the average being around age 51 in the US. Menopause is defined as the permanent cessation of menstruation, and it's confirmed when a woman has not had her menstrual period for 12 consecutive months. Women who smoke or have undergone certain cancer treatments may experience menopause at an earlier age. In addition, women who have undergone surgical removal of their ovaries will experience sudden menopause, which can be more severe than natural menopause. Some women don't have any trouble with menopausal symptoms at all, and they may actually feel relieved that they no longer need to worry about painful periods or getting pregnant. That's normal too. Others may have multiple symptoms. Symptoms of menopause can actually last for up to 10 years. However, most women experience symptoms of menopause for less than 5. So what are symptoms that we see along with this stage? Menstrual irregularity, this is to be expected. It's, again, the first symptom that started back in perimenopause, and we're looking for it to stop completely for 12 months to fall in the menopausal phase. Weight also begins to accumulate and can become harder to lose in this phase. Again, we've got some fatigue, energy lowers. You can have multiple slumps throughout the day. Also, those hot flashes and night sweats. We get chills, the opposite side of that come up. Sleep disturbances such as insomnia, midday crashes or need for naps, waking frequently during the night. There may also be some memory problems or difficulty concentrating that come up. We can notice skin changes such as dryness, thinning, wrinkles. Libido can take a stark downturn. It was taking that slow slide with perimenopause. It can take a drastic turn here. And there could be digestive issues such as bloating, gas, constipation that appear as well. As with perimenopause, menopause comes with its own unique version of common health concerns. We've got hormonal changes. This is a sharp decrease in estrogen and progesterone levels, and they can cause all kinds of symptoms like we've talked about previously with the hot flashes, night sweats, vaginal dryness, mood changes, sleep disturbances, all of those. We also have, unfortunately, a breast cancer risk increase after menopause. That breast cancer risk goes up. Most estrogen comes from fat tissue, and having more fat tissue after menopause can raise those estrogen levels, and it increases the chances of getting breast cancer. Doesn't mean a woman is going to. Remember, we're just talking about risk. Women who are overweight also tend to have higher blood insulin levels, which can be a contributing factor as well. We've also got heart health. Estrogen has that protective effect on the heart, and as the estrogen levels decline during menopause, women can experience increased risk for heart disease. Low estrogen can increase the cholesterol levels, and it can also further increase your risk for developing heart and circulatory disease. Menopause has also been known to correlate with heart palpitations, so that's where you feel your heart beat faster than usual due to the changing hormone levels. And then, of course, there's a mental health component here. You can experience feelings of anxiety, stress, maybe even depression, anger, irritability, anxiety, forgetfulness, low self-esteem, loss of confidence, low mood, and feelings of sadness or depression, that poor concentration, often get described as brain fog or having a loss for words within this stage. And that can be part of all those hormone levels going up and down. It can also be just dealing with the stress of a change in your life. It's a very big change moment. So there's going to be that stress around it. Also, it can affect sexual health. So we talked about changes in libido, also can have some pain during sexual activities. And now, while it would be outside of our scope to discuss or prescribe treatments as a health coach, we can equip our clients with resources and work with them to formulate those questions and confidence to discuss it with their healthcare provider. Also, something to know here is those pelvic muscles, the tissue and the ligaments start to weaken in this phase, and the uterus can actually drop down into the vaginal canal, causing a uterine prolapse. When I read it, I thought, oh, that can't be something that happens often. And y'all, I was shook to determine that nearly 1/2 of all women between ages 50 and 79 have some degree of uterine or vaginal vault prolapse or some other form of pelvic organ prolapse. So factors that increase the risk for this include childbirth, age, obesity, chronic constipation, or having a hysterectomy. So this could be something that your client is battling with as well. Let's look at some case studies. Ooh, I forgot bone health. Let's talk about bone health. So with the decrease in estrogen levels, women are at that increased risk for osteoporosis, and that's that condition where it causes the bones to become brittle and fragile. And menopause significantly speeds up bone loss and increases the risk for osteoporosis. So research indicates that about 20% of bone loss can happen during these stages, and approximately 1 in 10 women over the age of 60 are affected by osteoporosis worldwide. Let's look at our case studies. So we're going to start with Karen. She's a 52-year-old woman who is experiencing symptoms of menopause, including hot flashes, mood swings, and insomnia. She's also feeling anxious and uncertain about the new phase of her life and is concerned about the impact of hormonal changes on her health. We could empathize with the difficulty of adjusting to this new stage of life, and we could ask her something like, imagine we're looking into the future and you see yourself in 10 years. You're healthy, you're happy. Could you describe what we see in that picture? What does your life look like? And this helps us to get her to pull in that new wellness vision, because what happens for a lot of women is their wellness vision that they create in their 20s, their 30s, even their 40s. Once menopause starts to occur, they start to see this change in life, and that wellness vision may not be the same anymore. And maybe they're having trouble envisioning what that next stage looks like. So we're going to help start to craft that and figure out, what does healthy and happy you look like today? We can also look at a client here like Suzanne. Suzanne is a 55-year-old woman who has recently entered menopause, and she's struggling with weight gain and a loss of energy. She's also experiencing joint pain and stiffness, and it's impacting her ability to exercise and stay active. Suzanne has a history of arthritis and is looking for ways to manage her symptoms and improve her quality of life. So after listening, reflecting, empathizing, and building rapport, asking her what the next steps she's ready to take would put that power in her hands. But we don't want to just throw out that question and say, what now? What's next? We could say something like, would you like to work together to develop a plan that addresses your symptoms and helps you achieve your goals? We can focus on making small changes that will have a big impact over time. And it can also be helpful to start with asking her what she knows about menopause, her symptoms, if she's seen a doctor, if she's using any medications or supplements, and what she's done that has worked, hasn't worked up until now. Again, this is a moment to tread lightly. You need to know your practice. You need to know the scope that you're practicing in as a health and wellness coach. In some cases, it would not be appropriate to ask about medications or supplements. Whereas if you're working with a fertility clinic, you're working with a doctor who specializes in that, it may be appropriate. So just a word of caution there to know the scope that you're working in. You can also highlight the importance of collaboration, encouraging the client to take ownership of her health. And by working together to develop a plan, the client's more likely to stay engaged and committed to the process. So we could say something like, I understand that dealing with arthritis and menopause symptoms can be really frustrating and overwhelming. It's important to take things one day at a time and celebrate even the smallest victories. Would you share with me what's worked to support the discomfort of arthritis recently? What are some physical activities that support or alleviate your pain, if any? And that way you can focus on that positive and what does work for her, and you can build from there. And of course, after menopause is complete, we move into postmenopause. Postmenopause can bring its own health concerns with things like, again, osteoporosis. We've got that increased risk of bone fractures, cardiovascular disease, including high blood pressure, heart disease, and a higher risk of stroke. Changes in cholesterol levels with that tendency towards a higher LDL, the bad cholesterol, and lower HDL, the good cholesterol. Could have some urinary incontinence and recurrent urinary tract infections. More than half of women in the United States have experienced urinary incontinence at some point in their lives, and women are twice as likely as men to experience the condition, and that risk elevates in the postmenopausal period. Could be discomfort during sexual activity, that decreased libido. There can also be an emotional component here. Joint pain and stiffness, especially with that increased risk of osteoarthritis. Weight gain and changes in body composition. Many women report not feeling at home in their changing bodies during this time. There could be an increased risk of certain cancers, including breast and ovarian cancer, changes in skin elasticity and appearance, with again, that increase of dry skin, and cognitive changes such as memory problems and difficulty concentrating. And that can be really scary and unsettling. So along with those symptoms, there are some common health concerns specific to that postmenopausal period. So within those hormonal changes, estrogen and progesterone levels are remaining really low. Again, we're seeing a lot of those things with vaginal dryness, decreased libido, mood challenges. It's difficult to maintain a stable mood sometimes because the hormones haven't quite stabilized yet, especially as we're coming out of menopause. There can be a breast cancer risk. We've talked about that elevated risk. So regular breast exams are great. Mammograms are great for early detection. Breast cancer is the most commonly diagnosed cancer among women worldwide. Approximately over 2 million cases are diagnosed each year. And the median age at the time of a breast cancer diagnosis is 62, which usually falls in that postmenopausal years. Again, that's a median age. It doesn't mean necessarily that women have to be around 62. It means we're going to have some that are younger, some that are older. It's just that median. And then heart health. Women remain at an increased risk for heart disease after menopause. In the United States, heart disease is the leading cause of death for women, accounting for approximately 1 in 4 female deaths. During and after menopause, a woman's body gradually produces less estrogen, and that increases the risk of the coronary arteries narrowing, whereas it previously protected the walls, the lining of the artery wall, specifically reducing the buildup of plaque. And so all of that together increases that risk of developing coronary heart disease or a circulatory condition such as a stroke. And then mental health. Many women in postmenopausal experience moodiness, anxiety, depression, and that can be caused by stress, sexual tensions, or other life challenges that occur during that time. Some people feel sad that their reproductive years are over, and mood symptoms can also be caused by those decreased hormone levels. Of course, overall health, as our bodies change so much during this period, it can be easy to attribute any new symptoms to the menopausal cycle and miss early detection of other issues. Again, we talked about that tip of the iceberg where it becomes kind of this catch-all bin that we want to throw all of the symptoms into, even though it definitely does not mean that they're all caused by that. And then bone health. Women are at an increased risk for osteoporosis after menopause due to that decrease in estrogen levels. In the US specifically, osteoporosis affects approximately 1 in 4 women over the age of 65, and that comes with an increased risk of fractures and disability. Those fractures, of course, cause pain, decreased mobility, and decreased function, and fractures are associated with a decreased quality of life and increased mortality. So that can be another big challenge here. Again, the good news is that lifestyle factors and really taking care of ourselves can help mitigate a lot of these things. And that's where health coaches can really come in. So let's look at these case studies. So Cynthia is a 58-year-old woman who's recently retired and is feeling a lack of purpose and fulfillment in her life. She's also experiencing joint pain and stiffness, which is impacting her ability to stay active and pursue her hobbies. She's looking for ways to improve her physical and emotional health and regain a sense of purpose in her life. Cynthia has had a lot of change in her life, retirement, and a loss of some of her favorite activities. So we would really want to empathize with this change, acknowledging that it's a difficult time, work with her to assess how the joint pain is showing up, whether it be beneficial to work with her physician for additional support, and help her identify activities that bring her joy or that she's been wanting to try. That could be a helpful first step. We also have Joanne. Joanne is a 55-year-old woman who's been experiencing pain during sexual activity since entering postmenopause. She's feeling frustrated, embarrassed, and isolated, and she's struggling to talk about her concerns with her partner or healthcare provider. Joanne's looking for ways to address her physical and emotional pain and improve her sexual health. Again, as a health coach, we want to create that safe and comfortable space for the woman to discuss her concerns. We could start by explaining and giving her resources that pain during intercourse is common at this stage, and it's important to address it and for her to be able to feel more confident in her sexual health and her well-being. We can reassure her that discussing this with her partner and doctor can be helpful in finding a solution. And of course, if she'd like, you can work together on identifying comfortable ways to communicate those topics and have those conversations. Again, cautious of scope here. When in doubt, refer out. But we can definitely work within this a little bit. We could also address her physical pain by referring her out to a gynecologist or a primary care provider, or equipping her with some resources for physical things that could be causing that. And we could say something like, it's important to remember that sexual pain after menopause is a common issue that many women experience. Your physician is a trained professional who has likely helped many women with similar concerns. What would help you feel more comfortable and confident approaching the conversation with your clinician? And of course, in terms of emotional challenges, we can explore with her what emotions she's experiencing around the issue. She could feel embarrassed, ashamed, or anxious about discussing it with her partner or healthcare provider. We could validate those emotions and again, encourage her to express them in a safe and non-judgmental way. I think here too, it's helpful to say that while we're helping our client, it's also okay to note that if you're not okay and comfortable talking about these topics, just as the client's in control of their health and wellness journey, you're also in control of your boundaries as a professional. So if there's topics you don't want to cover in your private practice, just be sure to set that clear intention with the client before they sign up to work with you. So outlining expectations is always a win-win and is always important for both the client and the coach. I know we're getting there to time. We have just a few minutes left, I promise. Really important piece here about lifestyle related health concerns. So regardless of the age and the stage, there are things that cover that whole span. So mental health, we've touched on at each stage, but remember, women are more likely than men to experience symptoms of depression, anxiety, and other mental health disorders. In fact, women are twice as likely as men to develop major depression. Stress management, women are more likely to experience stress-related health problems such as insomnia, irritable bowel syndrome, and chronic fatigue syndrome, much more so than men, and stress has various causes. So both men and women experience similar sources of stress, such as financial concerns, job security, health, relationship problems. However, women tend to have additional stressors that are unique to their gender. So in today's society, women typically juggle multiple roles, including family obligations, childcare, elder care, which statistically is more likely to fall on women, work responsibilities, and other commitments. And as the demands of these roles increase, women can feel really overwhelmed with the time constraints and unfulfilled responsibilities. And they can also experience a sense of inadequacy for not meeting expectations set by themselves internally or maybe by others. And frequently, women will prioritize fulfilling others' needs over their own, leading to that neglect of their own well-being. And that neglect can become so pervasive that women may not even realize what their own needs are when functioning under high stress levels. So as coaches, we have a huge potential to come in and help women focus on themselves, help them find what that healthy looks like. You know, it's like the old adage on the airplane, you have to put your own mask on first before you can help other people. So we can help women figure out what that looks like for them. There's also this weight management piece of that, right? So being underweight or overweight has its own health complications. It can amplify women's mental health concerns, as well as increase the risk for physical health concerns. Exercise and physical activity. We all know the benefits of moving our body and the impact exercise can have on our health, but more than 60% of US women do not engage in the recommended amount of physical activity, and more than 25% of US women are not active at all. Physical inactivity is more common among women than men. So definitely something that we want to keep in mind too. Sleep quality. Sleep is a challenge in different ways at different stages, from babies interrupting sleep to night sweats. Sleep can be a challenge and it keeps women from feeling their best. Research suggests that women may need more sleep than men. So while the exact amount of sleep needed can vary from person to person, studies have shown that women tend to report more sleep disturbances and daytime fatigue than men. As a matter of fact, one study conducted by the National Sleep Foundation found that women tended to report more sleep problems than men, including difficulty falling asleep, staying asleep, and waking up feeling unrefreshed. And the study also found that women reported a higher frequency of daytime sleepiness and a greater need for naps. We can also experience a little bit of mom brain. Now, this is a completely colloquial term used to describe the cognitive changes that some women experience during pregnancy and after giving birth. I like to say I have teenagers. I still have a little bit of mom brain. The changes can include forgetfulness, difficulty concentrating, reduced attention to detail. And while the exact causes of mom brain are not entirely clear, research does suggest that hormonal changes during pregnancy and the postpartum period may play a role. For example, increased levels of the hormone progesterone during pregnancy can affect cognitive function, including memory and attention, and sleep disturbances, which are common during pregnancy and after childbirth, can also contribute to those cognitive changes. It can be a really frustrating time. There's also immune conditions. Women are more likely to experience autoimmune diseases than men, with conditions such as lupus, multiple sclerosis, and rheumatoid arthritis affecting women at a rate 2 to 10 times higher than men. And women account for an estimated and astonishing 78% of people who have autoimmune disorders. And of course, chronic pain. Women are more likely than men to experience chronic pain, with conditions such as fibromyalgia, migraine headaches, and TMJ affecting women at a higher rate. So for example, fibromyalgia is a condition characterized by chronic widespread pain, and it's significantly more prevalent in women. About 80 to 90% of diagnosed cases are women. It's a huge percentage. Good news is all of those things on our screen are well within the scope of a health and wellness coach to work on. So a huge opportunity. And we're getting to the end here. So our key takeaways: women's health is a complex subject, and educating ourselves on the various issues related to fertility, hormonal cycles, reproductive health, mental health, chronic pain, immune conditions, sleep health, and aging will help us support our clients more effectively. And health coaches can help by offering opportunities for education, emotional support, accountability, motivation, behavior change tools and plan creation, and referrals as needed to help clients be their happiest and healthiest. And each woman will have her own unique health journey. Health coaches are primed to support them at every single stage. So as we wrap up our presentation, I want to personally extend an invitation to you to join our coaching community if you are not part of it yet. We have a ton of helpful resources to help you manage your coaching practice. Everything from the dynamic, all-in-one, everything that you need platform for your coaching practice, to the coach's resource library, which has tools such as decisional balance worksheets, wheel of life, life mapping exercises, all that you can use to support your clients.